So, good afternoon and welcome everybody to this, our third mental health focused webinar looking at the support and the needs of the Ukrainian community in the UK. This afternoon, I'm very pleased to welcome back Alexander Dmitrovich to talk about his understanding of the experiences of Ukrainians in the UK and the kind of mental health issues that people might be experiencing and the kind of the way that that has unfolded over time. We're also very pleased to welcome Lisa Spriggs, Kerry Matcham and Kate Holmes as well to join us this afternoon to widen out our discussions into looking at what support is available for people from the different sectors within the UK. We're all based in Dorset, so we're going to be sharing a lot of information about the local Dorset offer, but this is something that is replicated in various forms in other parts of the country as well. So we hope it will be of interest and useful to people in other parts of the country who may watch this video later on. Lisa's come from Dorset Healthcare, which is part of the NHS network of providers in Dorset, and Kerry has come from Dorset Mental Health Forum, which is a voluntary community sector organisation that's contracted to provide mental health service and support across the Dorset Council area. And Kate Holmes is from ICN, working with refugees and all sorts of people who are moving to the UK, asylum seekers and so on, that need support as part of their transition and settling into the UK. This afternoon, we'll have a presentation from Alexander to set the scene, and then we'll have some presentations about the kind of mental health support that's available within the UK and in Dorset specifically. And as part of that, we'll have a discussion at the end where we'll talk about what particular support is maybe missing and how we can work better together to make these services link and be really available for people where they need them, in the places they need them, and at a time that they can access. So it's a great pleasure again to welcome back Alexander, and over to you to start our afternoon. Thank you very much.
Thank you very much, John, for this brilliant introduction. I'm really happy to be with all of you today. And basically, I would start my presentation with the words of the gratitude to the whole UK community for this brilliant support which you've been giving to Ukrainian refugees, to your government, which is supporting Ukraine by all means. You know, this is the thing which we never could expect, but the life showed that we have huge support from the side of your country and of your great nation. So just very briefly about myself. For more than 20 years, I've been working for different international organizations. Most of them, the headquarters of them, are based in UK. I'm working for the maritime sector and the sector of the aviation security. And since 2014, I also gave a lot of trainings for Ukrainians, internally displaced people, Ukrainian military personnel, fire brigades, and police officers. Why it happened so? Because at the, let's say, first stage of the Russian invasion into Ukraine in 2014, we didn't have the system of the crisis response. Well, we did, but it was more technical rather than humanitarian or psychological support. And I was quite fortunate to be trained in UK, in London, by Marshall Strass. This is the system which has been using for Royal Commanders of the British Navy. And that's a system which is a trauma risk assessment and management. And on the basis of the same structure, we conducted psychoeducational courses for the big number of Ukrainians. And at some stage, we had more than 10,000 Ukrainian civilians and military personnel who passed our courses, and we did all our training on the basis of the Ukrainian National University, Odessa National University. So it so happened that at the time when war started, I was employed by the international organization, and I started to do my work abroad, mainly in Europe, helping to set up the sanctuaries for Ukrainian refugees. They were mainly maritime and aviation professionals, and also for their family members. So as I said, I had my records until August of 2023, and during this period, starting from the February 2022, means since the very beginning of war until the August 2023, I had more than 1,600 interviews and individuals who I had interviews with, or we worked giving them the group support, psychological group support. So, and I did manage to see the tendencies, and I listened to people, I listened to their replies, and by doing so, I could trace what are the stages people are going through in terms of the, let's say, how we cope with the crisis. On the latter stage in 2022, I moved together with my family to UK, to Dorset, and I had several meetings with Ukrainian refugees in Dorset as well. So just, that's a brief photos about myself. I'm not going into details, but this is the scheme which we usually use in order to describe what the crisis is. So there is a pre-crisis stage, and this is the stage when we can do a lot in terms of the preparedness. This is when we give, all the trainings and things like that, hoping that crisis will never happen. But sometimes it happens. And I myself, I remember, while I was, I believed myself to be well prepared for crisis. I remember this early morning when we heard the first missile attacks and massive explosions in Odessa city, where I and my family were from Odessa. And, I jumped out of the bed, and my wife, she asked what was that. And I said, I was not able to differentiate whether it was a terrorist attack or a missile explosion, because for my 50 years of life, I've never heard, missile explosions before that. But, we had a sort of a emergency plan and had months before war started, partly because of my profession, partly because of my understanding of the situation, but the whole family was prepared to leave to evacuate from the city and from the country in case of emergency. So, and but no one wanted to believe into that. And I remember, I was standing, and I literally gave a comment to my wife, telling, just, bring all the stuff and documents and start call children and move down to the car, to the parking. So the car and everything was prepared. And I was standing, and she of course, she questioned what I said, and she said, are you sure? And in my mind, it was like a nightmare when you don't want to believe that, this happened. And then, there was sort of internal dialogue when I said myself, oh, come on, for more than 12 years, you've been teaching crisis psychology, and you tell people what the denial stage is. And your survivor is only in action. Stop thinking, just do. You don't have to think, you just do. Just action, 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 action. That's what you need. And basically, we were lucky to leave, and then well, I started my activities. Why I'm telling you that is that same feelings had almost all Ukrainians I've spoken with. All of them describe this kind of an internal dialogue, which we usually relate to the stage of shock. When we go through the shock and then denial, some people can stuck in some of these stages, believing that it's going to be over soon. Maybe it's a sort of a mistake and things like that. So for me, it was crucially important later on, because I'm still giving training and support for the military personnel in Ukraine. I usually explain that, if you catch your mind on stucking in denial, this is really dangerous. Instead of, stucking, you need to act. So, but I saw many cases where people, stuck in denial stage for months. I had my colleagues because I was defending. It was in 2012. My dissertation in the University of Internal Affairs in Kharkiv, and you probably, if you can imagine the geography of Ukraine. Unfortunately, now everyone, I mean, most of the people in Europe, they can imagine they understand the geography of Ukraine. So Kharkiv is a front line. And I had many colleagues from Kharkiv and from Mariupol, and we were on the telephone because again, within 5-6 hours after the Russian invasion, I had blast of phone calls from different organizations asking about the evacuation routes out of the cities, frontline cities. And you probably know that large organizations, they have sort of the contract with private security, international companies, but they were not able to do anything. And we did manage with volunteers to evacuate people because volunteers, they were on land. They were helping, and they were, they helped a lot of people to flee the war zone. So, but I saw also people who denied any potential threat. I mean, obvious physical threat. That's a war. And unfortunately, I lost several friends who just simply refused to go. But not only, during the first days after the onset of war, we observed that, but also several months after, even when people reach safe places in Europe or in UK, interviewing, for instance, seafarers, I heard a lot of complaints from them, and they said, for instance, my wife is in depression, and when I spoke to her, to his wife, in most of the cases, what we did manage to find out that she was reluctant to accept the reality. In most of the cases, for many Ukrainians, it was like being in Poland or being in Germany or being in UK. This is just a temporary measure. I'm going to go back into Ukraine soon. The war is going to over soon. And because they had this sort of mindset, they were quite reluctant to learn language, culture, to be employed, to find, a place to live, etc., etc., etc. So, but on the contrary, those who had a sort of a mentality, like, come on, I'm not sure for how long I'm going to stay in this country, but I need to adapt. Those people, they recovered more quickly. They, this is the clear model or clear example of how the coping mechanism can be effective or inefficient, but depending on the mentality. And that's what I observed in 20. I mean, starting from 2022 up to 2023, doing regular interviews. Later on, I mean, 2024, I saw again in 2022, 2023, nearly 70% of Ukrainians would tell, we go back to Ukraine. 2024, the number dropped down to 40%. 2026, and that's the formal data we have from one of the ministries of Ukraine, which said that around 33% of Ukrainians living abroad stated that they would go back to Ukraine after the war would be over. But that's again the statement. Why? Besides, this crisis timeline that you see on the screen, we understand that 3 years have passed since the onset of war. Many families, unfortunately, broke up. Many people I know have adapted for their lifestyle in different countries. They found employment, education, their children. For instance, I have my grandson, and together with my daughter and her husband, they left in 2022 to Canada. So he was 3 years old. Now he's 6.5. So his English is much better than my Russian and Ukrainian. So he's been adapting to life there. So for most of the parents, it's illogical, and it's almost impossible that they bring their children back into the country right after the end of war. I'm just talking. I'm very honest, and I'm talking about real life scenario, not trying to put the pink glasses. So, and that's what we understand. In the meantime, we know that the ambiguity in terms of plans, governmental plans of European Union and UK create or contribute to stress to Ukrainians because, they are temporarily in UK or in Europe, and they do not know their future. So on the one hand, they don't know their future because of war. On the other, because of the, let's say, government decisions, and that creates more stress for them. And with regard to the clinical picture, I had quite many cases where I helped Ukrainians to go through, and with post-traumatic stress disorder symptoms, at least. It wasn't diagnosed PTSD, because in my practice, frankly speaking, I never had any case in UK where some of Ukrainians was diagnosed. So we saw clear clinical picture, and there was symptoms, and that's where I helped with the counseling sessions. But it wasn't diagnosed by, for instance, NHS, by psychiatrists. But it was in the very it was 2022, 2023, where there was a big flux, a big number of people coming from the war areas. Mostly I observe stress-related disorders due to the change, due to the immigration, news, adaptation in new country. So the term migrants depression has been used more and more widely by Ukrainians, because again, so the classical term, I'm pretty sure you're quite well aware about it, but it was a voluntary migration in terms of Ukrainian. That's a forced migration due to the war. So, and the symptoms can be even more severe. So, and all these factors, of course, they contribute To additional stress, and we know that stress may provoke even psychotic disorders, which uh, might have been in a, let's say, sleeping mode and never popped up, but due to the high level of stress, they manifest. So that's why I also had, and I helped with two cases of Ukrainians who had psychotic episodes. Uh, in one case, it was bipolar. In other, it was even suicide attempt with hallucinations and everything. And that's where I uh, made my first steps, testing how it is possible to collaborate with NHS. Mean helping with to explain what is the mentality, what is the, let's say, what stands behind the language peculiarities, because I understand that all of you are professionals, and we call that the verbal markers and uh, verbal keys of how we communicate and what we understand from the, and that's crucially important when we give mental health support or give counseling sessions. And of course, in many cases, like, in cases of psychotic episodes or severe depressive episodes, or in some cases of anxiety disorder, we're not able to deal without pharma therapy. So that's where the collaboration in between talking therapists and psychiatrists is crucially important. So that is why I should say, I mean, besides my professional activity as a crisis responder, clinical and crisis psychologist, and CBT counselor, I do a lot of teaching. And one of the projects I'm taking part in is UpPro School, which is Ukrainian online university, and which has been accredited by the Ukrainian Ministry of Education. And that's why I have I mean, after graduation, most of the students, they prefer to stay in touch. And I have large roster list, which is more 2,000 Ukrainian psychologists living in different countries, including Ukraine. And they want to be uh, useful for Ukrainians living in different countries. That's why, a little bit of a spoiler, but the idea is to give them an opportunity to be trained for the, in case of UK, for UK standards, and also be helpful for Ukrainians. That's one of the ideas which uh, I would like to discuss with you. Thank you very much for your attention. Sorry if I've taken a lot of time, and I'm ready to answer your questions if you have some.
Thanks, Alexander. I think the reflection on that kind of process, the immediate impact, and then the kind of or the developing impact of the trauma and the ongoing re-traumatizing experiences that people are having as this war continues is really helpful in terms of trying to see where issues might emerge, how different people have responded, and therefore what the kind of level of need looks like. Very struck by the concept you mentioned there about awakening deeper issues for people that might have been slumbering. I think that's quite a powerful image. But equally, that idea that people are on a different set of timescales in their lives, depending on whether they've got children who've got, as you say, embedded into the community and their lives are here. And it brings all sorts of other needs and contexts to kind of be aware of, really, which is really helpful to begin to understand. Does anybody else have any specific questions at this point for Alexander, or shall we have a chat about what we have available in the UK at this point in terms of our health service, mental health service in the NHS and in our community and commercial sector? In which case, Lisa, would you like to
Yeah,
come on in? And
thanks, John. Are you going to share the slides?
I certainly will. I shall do that right now.
Welcome, everybody. People that are here in the space that join later and watch the recording. My name's Lisa Spriggs. I'm the lead for trauma-informed approaches with Dorset Healthcare. I just get my colleague to introduce herself as well.
Hi, good afternoon, everybody. My name's Kerry Matcham. I'm the interim peer lead for complex trauma for Dorset Mental Health Forum, and I work in partnership with Lisa a lot.
And I guess what I was just really reflecting on what Alexander said, and that lived experience of actually how it feels to be disconnected from your identity, your community, your language, and feeling that what control you have about, you know, when you move, what you do. It really made me think about some of our community offers that we have, Kerry. And
Yeah, absolutely. And that feeling of belonging, which is so essential to our well-being and our mental health more generally, and that feeling that we have a sense of control and we have a sense of being part and an active part of our communities as well, is such an essential ingredient when we're talking about what we mean by belonging.
Thanks, Kerry. So John's really kindly put this chart together.
Yes.
And actually what we're going to start with is on the kind of left-hand side is actually, you know, that if there's a low need, if you're kind of starting to feel a bit anxious, or you're just noticing things aren't going right, or your sleep might be impacted. And just to say as well, although we're talking about Dorset, most of these services will be available in the UK. It might be called something slightly different.
Yeah.
So that low need, so we'd look at self-referral, that you don't need to see a psychiatrist, you don't need a diagnosis or a label. So that would be thinking about your doctor, your GP. You can go and book an appointment and just say, I'm noticing these things going on. This is how it's impacting my life. Actually, you know, what can I get for help? But also steps to well-being, where we look at CBT and living with, and we look through things like from sleep to mood to kind of anger. And they're really useful because that's low-level CBT with trained therapists who can support you to think about what that looks like. And I'm sure John will share the links that is available to these places as well. And then the Recovery Education Centre, Kerry, I didn't know if you wanted to talk about that.
Yeah. So the Recovery Education Centre is a Dorset project, but there will be recovery colleges nationwide. They are a place to come and learn about mental health and well-being, and all of our offer is co-designed with people with lived experience and people with learned and professional experience. And again, we don't say that we refer to our recovery education. We like to give people choice. They can come and join us. They can join us online. We've got lots of online resources, but they can also join us for interactive learning sessions, both face-to-face and online. And those courses cover a variety of topics. So you've got things around sleep and mood, but then you've got more specific things around specific diagnosis. So we talk about bipolar and psychosis and unusual experiences. And we have a range of complex trauma offers where we're looking to support people who have lived experience of trauma.
Thank you. And they're free to use for anybody that lives and works in Dorset or has a service in Dorset. But as we say, nationally, there are lots of recovery education centres. For those of you who are watching who might be parents, the Discovery Education Centre is an offer for children and young people but we also run parenting courses as well, and we'll share those resources with you, and everybody is welcome as well.
Absolutely.
And then we go to, and this is still self-referral and kind of self-access really. And I'd include in this going to our emergency departments in our hospitals, where we have mental health specialists called psychiatric liaison teams. And they can support you and work with you if you've got an immediate crisis. For example, if you're noticing lots of unusual experiences and you're really frightened, go there and you'll get support. And thinking about that crisis part is the next step that we go into. So we're going to kind of going from that lower impact of what's happening for you and what's happened to you. So like it's going into that middle bit that is having more of an impact really. So we've got a model, and these are available, although called different things nationally in Dorset, called the community front rooms. And these are open access places where you self-define your own crisis. You don't have to wait for somebody to say, you're in crisis now, or you reach our, you've got so many kind of ticks and your labels that you can access this support. And they're co-run by several charities and the NHS in Dorset. And I think what's really important is that sometimes if we can act earlier in a crisis with people, actually we can actually reduce the impact of that crisis on themselves, their lives, and also
And
the
the
impact on their families. And
I
then,
was just going to say exactly the same thing. And families can attend with people as well. If you have a loved one that you're concerned about, or that you would like to seek some advice and support if they're starting to struggle, you can go to any of these places with them, and they are located across the whole county.
and the retreats, one of my passions, because I help set them up, is it's open a lot more than community front rooms. And we really we also accept kind of paramedics and police bringing people in when people are in acute crisis. We don't prescribe medications or do assessments, but what we do is offer a safe space to people to make sense of things and to make a plan to help people keep safe for now. And that's really important. And we have a lot of evidence suggests that we kind of enable people to carry on living the lives they want to live even when in crisis. So I'd always say if you're really struggling, they're a good space to go to.
Absolutely. And you'll be able to meet people there with lived experience as well, which can sometimes feel a little bit easier to have a conversation with somebody who's been through something similar.
And one of the innovations of a lot of changes going on in the NHS at the moment is our access wellbeing hubs. And they're really places where, rather than having to go to lots and lots of different places to get the help you need, there's space to go to say, I've got, I might have a problem with my housing or my job, but also I'm noticing I've got a problem with my mental health. Space that you can go to, have a cuppa, people will work with you to think about what the plan is, help you connect to those sources of help, but also might do a bit of a longer term piece of work with you just to do some psychoeducation about what are the next steps for you. So guiding you and navigating you to those sources of help in the longer term.
And like the other offers, there are wellbeing hubs and wellbeing drop-in spaces across the whole county. So no matter where you live, you will have access to a space near where you are.
And these are available nationwide as well. We know it's a model that has been utilised across the county. So, and part of that kind of almost like you're dipping into crisis where things are getting more difficult is our Connections phone line, which is open 24 hours a day, where anybody, you don't need a referral, can phone in and say, I'm really struggling, and trying to make sense of that. And also thinking about, what can I do? And sometimes I know from my own experience, when I've had problems, talking to somebody, they can't make it magically better, but that sense of being heard and seen is really important, especially when you don't want to burden your family with your distress or your colleagues or friends. So I think that's...
And I was just going to say, you can access connections by dialing 111 and then selecting the option for mental health, and you will be put through to the team of mental health specialists.
And I think they've been really helpful to people in all fields of life, but also, you know, my colleagues here who might be working with somebody and feel a bit stuck, you can phone connections, but also family and kind of friends can phone connections if they're concerned about somebody. So it's a really good resource, and we're kind of trying to promote it a bit more.
We are.
Kerry, do you want to think about the next step as well?
Okay, so when we're looking at the next step and things are potentially getting more difficult, we have a range of more specialist services that you can access, and this access normally comes through your GP, who can make a referral for you to a specialist community mental health team, where you will have access to specialist nurses, occupational therapists and medics who deal specifically with mental health conditions, with mental health distress, and supporting you to manage your mental health with medication, if that's the best route, or with recovery skills and opportunities.
And I think it's really important to recognise the fact that actually kind of the way we work with mental health is changing. And Alexander, it's really interesting thinking about the way we work is much more trauma informed.
Yeah.
So it's not just about the immediate problem, but what sits and lies beneath that presenting issue. And then, you know, really thinking about sometimes your GP will refer you to more intense therapy in steps to wellbeing, but also they might monitor your medication and see how you're getting on, because also your physical health is really important when we think about this as well. And your GP might refer you to our clinical psychology team and psychiatry. And we have a range of different therapeutic approaches in Dorset, as we do nationally. And we're really thinking at the moment, while we go through the system transformation, about having more open access to these services. So, for example, we've got some learn online resources within our clinical psychology team. And actually, we can kind of share those with John to share after this. Sometimes when things get really, you know, when Alexander was talking that immediate post and long-term crisis, and a lot of us can hold on for a really long time, but sometimes, you know, you might go to our emergency department and you might have a general inpatient admission into our general hospitals, just while people are trying to work out what's happening for you and what's happening to you and the impact. And that's really important sometimes, just to kind of make sense of the situation rather than rushing you into a process. And of course, like everywhere, and when things get really hard for people, when there's an acute crisis and we need more professional kind of support and it's more critical, and you know, we're wondering about the long-term impact. Alexander mentioned psychosis and suicidality, so that safety to yourself or to others. That's when we think about an inpatient admission. That's when we might think about the Mental Health Act or Capacity Act, and really thinking about what's best for you. So we might take those decisions for you and about you, but with the ethos on trying to get you to reach that point in your recovery as soon as we can to support you to get back to the life that you want to have. I think what's really important is that, you know, we always want to work with you and your families and your communities to make sense of the situation. Yes, we have great services, but we also know we can always do better. And I'm really interested to think about the work that we can do together to kind of think about what inclusion and access looks like for you. Kerry, I don't know if you wanted to add anything to that.
No, I didn't. I was just going to say something that echoes what you were saying about, you know, that inclusivity and making people feel welcome, but also so that people feel empowered to use what's out there and feel that they have choice and agency and control.
Thank you both so much for that. That was a really beautiful presentation of a very, very complex system. But I think what comes through very strongly is that there's this range of options available, and that wherever you join, whether it's self-referral, whether it's a referral through another agency, a GP, or somewhere else, the emergency department, there is a connection between all these different networks that hopefully will find the right support for you at the right time. It is all under change, and it's improving all the time. And as Lisa said, I think this is a very special opportunity, I think, to look at how some of these trauma-informed approaches can work even better in the specific area of needs around the Ukrainians in the UK. And I really appreciate the way you took us through that. Thank you very much. I've also put a slide together which talks about the offer that is available from other places. So that's a largely NHS focused or NHS commissioned offer. So that's the statutory services within there, but it's not just statutory services that are available to us in the UK. We also have a very flourishing and vibrant private sector for mental health support, and a lot of organisations that provide mental health support from the voluntary community sector as well. And I'll just put a little slide here just to give a bit of structure to how you might encounter them. So on the top left there, we have service providers. So a range of qualifications and skills and techniques and approaches that people use, from counselling, which is seen as quite a sort of low level approach, to psychotherapists and psychological therapies that may be very specific around particular types of support that people need. So it could be a particular style of therapy, or it could be a particular type of condition or a type of issue that you're working with. We have medical specialists who are working in the private sector, including psychiatrists and clinical psychologists. So there's a kind of parallel private sector that mirrors some of the things that we've seen on the previous slide in the NHS, and you can access that through various networks. And there are also private clinics and hospitals that are available across the UK that you can access, some of which are in Dorset as well. Those services that people offer on the top right-hand side there can be everything from assessment and working out what sort of understanding we might have about the things that you're experiencing, and to help understand what that's about, where it's come from, how it's impacting you, and perhaps even looking at diagnosis if we're talking to one of the professional providers in that sector. There's also referrals possible, and there's also direct treatment as well. So you can receive treatment from qualified clinical psychologists and therapists and so on in the private sector. And the way that is delivered can be in a number of ways. So the provider types on the right are quite a spectrum. There's value in each of these, and they each have their different qualities. There's an awful lot of informal peer support that happens in all sorts of places that probably doesn't even get a label as being mental health. It might be your local football team that you go along and you play five-a-side football on a weekend, or you're in an art group or a singing club, and that mental health support is just part of the life of that activity. It's just the well-being that we feel when we're part of that group and participate in things. But there's also informal groups that might be a little bit more structured around a kind of peer support. So it could be people who are dealing with bereavement, for instance, and want to get together to just share their experiences of the mental health impact of bereavement and loss. That can be semi-structured. It can be around various themes. There can be structures for the meetings, and some of those are being provided by voluntary community sector organisations, for instance. There are lots of other voluntary sector organisations and charities that provide specialist support. That can be around relationships, it can be around individual mental health issues and themes. And then there are commercial providers that I mentioned already, where people have trained and skilled and qualified therapists and practitioners who can provide specific therapies in different contexts, sometimes group therapy, sometimes individual, and so on. In the UK, there are various regulatory bodies for formal psychotherapy training and counselling training. I've put a handful of them down on the left-hand side there that are the kind of major players. The United Kingdom Council for Psychotherapy, the British Association for Counselling and Psychotherapy are largely the two larger players that are responsible for the accreditation and regulation of the psychotherapists and counsellors who are trained within various different modalities in the UK. And then we have the Royal College of Psychiatrists who, as it says on the tin, are responsible for the regulation and the standards of the psychiatrists in the UK, and their professional body is the Royal College. And then there's another professional standards and regulatory body called the Health and Care Professions Council, which covers a whole raft of different health and care jobs and areas of specialism, which includes some psychotherapy and counselling and mental health support as well. So you'll find that that information is useful when you're trying to look for a safe, reputable, trained, experienced mental health practitioner to work with you if you want to work at that level. And there are lots of different modalities that therapy is provided through, and some of them will have their own regulatory body as well, usually affiliated to one of these larger regulatory bodies. And that professional standards covers accreditation and training. It also looks at professional regulation, so good practice and whether there are any issues with somebody's skills or their ability to practice safely. And the standards that exist in terms of things like supervision and safeguarding and all the other things that would be associated with working with people who are in need of support with their mental health. So alongside that big previous slide of NHS support, there's also a parallel amount of support within the commercial and the voluntary sector as well. And hopefully that gives a little bit of a structure for how these services are pulled together. So I'm going to pause and invite comments if anyone has got any comments to add into this as well.
John, I was just going to mention, we also, and I think nationally it's a case, and we have Dorset Open Door Bereavement Service in Dorset for people who are either newly bereaved or historical bereavement is impacting their well-being. And those teams will kind of support you through different parts of the system. We work with kind of funeral services in Dorset and counselling, if that's a kind of part of the impact that kind of is affecting people.
I think that's a really good point, Lisa, and I think that there's some very, very well established and well respected services across the UK that offer specialist support, for instance, with baby loss or with sudden traumatic death, or with other conditions as well that people encounter, and it's a really big part of the support that's available to us. And again, it's self-service. You don't need a referral necessarily to access those things. You can self-refer and get the help when you need it if you're able. So what I'd like to do now is to invite Kate to come in from ICN and to introduce the work that she's been working on in terms of the mental health support for within the context of ICN's work with refugees and asylum seekers. Thank you, Kate.
Hi, can you all hear me okay? Hi, I'm Kate Holmes. I work for ICN, which is the International Care Network. We are based in Bournemouth, and most of our work is related to this local authority, Bournemouth Christchurch Bull, but we do work across Dorset, and will support refugees, asylum seekers and vulnerable migrants from anywhere really. If they come to our door, we support them whatever way we can. So just to say a little bit more about what we do as an organisation, we're a charity that was set up 20 odd years ago, started as a sort of befriending organisation, but has developed in all sorts of ways. So the services we offer include English language lessons, advice, general advice and immigration advice. We offer community activities, and I'll talk a bit about that a bit more in a minute, because that's mainly where we're going, where we currently support in terms of well-being and mental health, probably. We also are contracted by our local council, BCP Council, to work with resettlement schemes, but the only one we work with at the moment is the Afghan resettlement program. We don't have a lot of Ukrainians coming to us. That we occasionally get Ukrainian refugees coming for advice in terms of immigration or other things, but at the moment we don't have a lot come through our door. And I think that's, you know, our main service users come through the asylum route. So they're often coming from Afghanistan, Iran, Iraq, Sudan, Eritrea, places like that. But we do have people from, as I said, from any route who can come and seek advice from us or get support with English classes and so on. So just to explain a little bit, so we have our community program. We do community support out in the community with women and families, and others who are community based and need support, sort of caseworker support or key worker support. But we also have a program of community activities. We have drop-in services in terms of advice and so on, but we also offer a range of activities, and they are very much related, I would say, to building community, but also supporting well-being. If you think of our asylum seekers who are based in home office accommodation locally, they're not allowed to work. They've come through very traumatic situations very often. They may be waiting a long time because of the backlog with processing asylum cases. So they need things to do and things to engage with, and that's where we come in and offer regular activities that they can get engaged in, ways to volunteer, ways to support what we're doing and develop their own activities in support with us. And we also offer some very specific things. We work a lot in partnership with other groups. When I come on, I'll talk a little bit more about the wellbeing in a moment, but Dorset Mental Health Forum are supporting us with setting up our wellbeing service, which is great. And another organisation we work with is an organisation called Koru, who offer, I don't know if you know them, they offer sort of therapeutic art kind of activities. We work with them to offer residential and other programs for asylum seekers and others. So that's a sort of broad brush, a little bit about what ICN does. We have, as mentioned by John, we are just about to set up a wellbeing service. We're not quite there yet. So what it looks like, what the shape of it will be, we'll, you know, watch this space, see what's going to happen. Obviously, we have some ideas about that, and it's been absolutely fascinating listening to you all today, and hearing about those different things. And I'm sure I'll be in touch with all of you again in the not so distant future to pick your brains a little more and talk about how we could work together. But I think, you know, obviously we have for a long time working with refugees, asylum seekers and other vulnerable migrants. You pick up on a lot of mental health and well-being needs, both from trauma that they've experienced in getting here, trauma once they arrive in what is a hostile environment very often for asylum seekers, and other reasons. You know, there's all sorts of things going on in their lives, and all that, the things you've been talking about in terms of uncertainty, and not being able to go home, and being away from family, and all those things that create a huge number of mental health and well-being issues. So we knew there was a need for this service, but obviously being a charity, we are reliant on what we can bring in funding and what we can support. So we're setting up a service. Our wellbeing coordinator will start next week. As I said, what it looks like, we're not quite sure yet, but it will certainly be offering group activities and the sort of peer support that you've talked about. We want to develop that very much. And signposting, a lot of working with particular cases and signposting to other services, working with our partners to pick up on that. It, as said, and as I'm sure you all know, this group is quite niche in terms of their mental health and well-being needs. That there are all sorts of challenges, practical challenges, systemic challenges in terms of what they're allowed to access and so on, cultural challenges in terms of mental health and well-being and whether it's recognised or talked about. Language is obviously a huge challenge. A lot of people don't have a lot of English or are only just starting to learn English, and so then trying to talk about these things and just all sorts of issues. So any support we can get in terms from you, from the people who have talked here about how we develop, but any ideas from people, anyone who's listening, or any thoughts about how it might work, or if they want to get involved and support us, we have a volunteer program. We're very happy to talk to people about how they think our well-being and mental health service might shape up. We have funding for it from the National Lottery, so we've got about 2.5 years of funding left to get this started and to see how it develops. So that's us.
Thank you so much, Kate. I think you've downplayed the amount of work that you do with the Ukrainians. We found your organisation hugely helpful in the early days when we were looking for all that practical support. It was a really important reference point for us in signposting people for support and help. So thank you for that. In terms of, joining the discussion and taking the conversation further, I think that's very much where we are now. So sort of segueing really from the setting out the scene. This is where we are. This is the need. These are the issues. Here are the systems that we're working with. I think the conversation opens up at this point to see, what are the missing links. Let's maybe start with Alexandra, just some reflections about what the opportunities are that you've observed, and maybe we could start developing some ideas off the back of that.
Well, the thing that I heard, sounds fantastic. I mean, that's great, and that what was my perception about the British system of mental health support. I just got one question. Maybe you can share your vision. How does it work if we talk about foreigners, if their language level is not sufficient for getting, I just want to stress, when we're talking about GP, that's fine. So the Google Translate or other services may help. The simultaneous translator can help. But when we are talking about mental health, how does it work? Because this is the area where we need to understand every language tints, every shade, in order to give sufficient support. That's why my question is, how does it work? Maybe you have examples. Maybe Kate can tell us about, how the refugees from Afghanistan or other cultures they get, because there are also the culture differences.
Yeah, it's very difficult because as well there's sort of ethical questions as well as about having a third person in the room. So yes, I mean, we use translation services. So we have a phone service that we use that provides translators, but we're using the service. We have no idea really very often how accurate that is in terms of translation always. And for us, it's not really tested in terms of mental health yet, because we haven't developed a service yet. So it's fine when it's, applying for housing or whatever, other queries where we're using a translator or immigration things. But when it comes to mental health, we haven't tested it yet. And it is, we know it's a crucial thing.
I can proudly say I got one of my clients. She's from Muslim community. She's Ukrainian. And besides, therapy sessions, I've got a lot of knowledge from her end about the Muslim community, the way they think. And I was fortunate because her mother, she's professional psychologist, and this lady, she was quite open, showing me the differences in mentality and everything. I mean, for instance, again, for everyone, CBT works in Muslims world quite well. That's it does not contradict the principles of mentality, but there are a lot of peculiarities. And also, I help her, but she helped me with understanding of this. But again, we spoke the same language. I mean, we spoke Ukrainian, but so means, well, and that's where we could, balance, let's say, differences in mentality, the diversities.
Yeah.
That's
I think, the cultural question is interesting as well. And we will, part of this project will be looking at, like I said, we want to involve our service users very much in design and development of this service and get their input. We have a lot of our service users already volunteer with us. So we can build that up and to work with them about how we may how we can work to overcome potential cultural barriers or find the best ways of working through those, cultural differences. So that'll be part of our learning from this project, I guess, that we will be able to pass on as well to others.
Okay, thank you very much. Lisa, maybe you can share what is the good practices which are being used by NHS in order to overcome the language barriers.
Oh, it's interesting actually, because there's everything seems to be transforming at the moment. There's a lots of tenders going through, and we've had some new guidance come out actually about, actually all those cultural considerations. And I don't mind saying I'm quite vintage. And I worked in a lot of places, a very, very kind of multicultural places. And I think there's also a real art to working with interpreters as well. And also I work with I used to work with a lot of deaf people, and there's a real art in thinking about your communication styles. So yes, the best practice is people phone up the translation services. If they knew a meeting was coming up, we'd book it. I think unfortunately sometimes that has been by phone, and that's quite hard for some people. So that's why I think there's a whole kind of sphere of work looking at that, because I think we're missing it sometimes. I don't know if you agree, John, in terms of the impact that has on Kate, because sometimes we miss those nuances. So, it, like you say, if it's something that's very kind of, the law or housing, but I know even in English, the nuances around talking about mental health are profound, and you really have to check your language and avoid the jargon. So actually, I think by thinking about inclusion and accessibility, not just in translation services, but the language we use will help everybody, because often we fall back into that default. Oh, this is the language, it means that we can do this, this, and this, without really thinking about the impact that it has on our communities and people that we serve.
I think that's a really interesting observation, Lisa. I'd very much echo that, but I'd also say that of all of the professions that exist within health and well-being, I would suggest that we have the best chance of working something through with those that work within the kind of psychological therapies and mental health space, because of what you just said. We're used to working through people's different languages and different ways of understanding already. This is a very specific and a very particular kind of set of challenges around around the language that we speak, but also how we use that language. There's something really about the navigating role as well, I think, in what we've been talking about. And Alexandra and I have spoken about this separately as well, where when you're approaching a person within any of our systems, the ability to talk about these things in a way that triggers the right response for the right referral is really critical too. And when your language or your confidence in your ability to speak English is less, the opportunities for confusion and diminishing the level of need, or being a bit kind of, oh well, it doesn't sound as bad as all that, when we're trying to establish what's going on, but actually it could be the limitation of the language rather than the reality of the person who's coming for help. And so I think there's something about being clear about the navigating of the system being enabled by people who can provide sensitive interpretation and translator skills as well, which is not any different from what you described in terms of the deaf community, or people with learning disabilities, or with neurodiverse, or with any other additional accessibility requirements. But in this case, I think it's a big missing link at this point. Kate, you had your hand up.
No, it wasn't a hand up. I was just applauding Lisa's comment about inclusivity and thinking about what language we use. That's Although good. I do have a question, if it's appropriate at this point, which is about. It was lovely to see all the services and things you talked about. Is all that for over 18s, and what is there for younger people?
So the picture that I put out there was an adult service model, because it's the one that's slightly further ahead in its development in Dorset, certainly. It's been 3 or 4 years worth of work gone into the development of the universal support offer for Dorset, and the building of the access wellbeing model and so on. So it's in delivery now rather than in development. And the child and adolescent mental health services are following in its footsteps. So they're being worked on at the moment in the design and engagement phase. They're not anywhere near as developed in terms of the offer at the moment, and there are an awful lot more gaps in terms of provision, sadly, at this point. And I think that's very much a national picture as well as a Dorset picture. But it would look very different for child and adolescent mental health services. And also the range of partners is a lot more complex in terms of settings, like the mental health in schools work that goes on and things like that, which are a whole different kettle of fish as well. So there's a lot of differences there for children and adolescents. And yeah, I would probably take 2 or 3 slides to kind of start to build a picture for that as it is, but it's also very much under transformation at the moment, as I think probably Lisa would attest.
Yeah, and for example, the Discovery Centre that I mentioned, that is for children and young people, and for parents and carers and kinship carers and guardians. And that's because we did a side-by-side modelling of the Recovery Education Centre and then what it would look like for younger people. But I think it is changing, it's a changing landscape, but we could send some stuff over just in a sense of where we're at the moment, if that's helpful.
Alexandra, one of the things that you mentioned in a separate conversation was the idea of how we can draw on the resource. You mentioned them earlier, the people that you've trained, the people that are interested in supporting from within the Ukrainian community, who've got skills and training in mental health support, in psychological therapies and so on, and what are the opportunities there for linking together with the statutory and the private sector that we've been looking at a little bit earlier. Do you want to say a bit about some of the ideas and opportunities you might be able to see within that space?
Yeah, for sure. But then again, there are few, to my point of view, few other things, which are crucially important to my point of view to mention. As far as I understand, if, for instance, I go to see a doctor, that's a mental health professional in UK, the chances that for the second time I would visit the same doctor are too low. Yeah. So other words, I have to start from the scratch, from the very beginning. Yeah. Providing that he has my file and everything. And that's a huge problem in terms of mental health services. Why? I had vivid example just recently with a teenager. Yeah, so she, I mean, she's 18. So, but she was prescribed medication, and fortunately, she's living in UK, but she stayed in contact with her Ukrainian psychiatrist, and this psychiatrist has been knowing her for 5 years. And but I mean, they may change the dosage, or they may change the the medication, and they can do that directly. But in many cases, that's from my Ukrainian practice, for the obvious reasons, mental health professionals like psychiatrists, they don't give the direct telephone number to the patient. And when I start as the talking therapist to work with these clients, sometimes I become sort of a facilitator, because people may have sort of side effects, and they because I spend a lot of time with them, during the sessions, and they complain about these side effects, and then I give them skills how to explain the doctor what they feel. And also sometimes I give tips, because not sure how it works in UK, but in Ukraine we have joint seminars when I ask doctors to give this psychoeducation or education about the medications that they give to the clients, because otherwise, it may have this sort of nocebo effect, or they have high anxiety because they get wrong information about this medication, or hear from their friends that these particular pills, they don't work, or they can make a veggie out of you or something like that. So it's crucially important, these sort of explanations given by the doctors. And very quite oftenly I explain to patients how it works, or facilitate their contact to with the doctor. Having said so, my question, how does it work within the framework of NHS? Even for English-speaking people, do they have an access? Do they have an opportunity to talk to the doctor? Because again, if he may have the appointment few weeks later, but the side effect he has or she has, can be frightening. So how does it work? It's not just for the sake of curiosity, but for the sake of understanding how to use Ukrainian specialists, even providing that they can be trained and comply with UK standards, but how to find this niche in order to facilitate all that kind of things.
Thanks. I think it's an interesting question, just in terms of it depends on the complexity of your issue. So, for example, if your need is high enough, and your GP has referred you to a community mental health team, you will usually get your psychiatrist. And psychiatrists don't change that much across teams. You might have a number of psychiatrists attached to a team, but it's not like kind of more than 4 or 5. There's not masses of them. I think what's really interesting, Alexander, the new kind of approach that we're taking actually is, how do we do that navigator role with people? Who's got the best relationship with that person to help them navigate all those different points? And what we've found that's worked really well with the Access Wellbeing Hubs is having virtual MDTs where the medic will go, where a peer worker or a housing worker will go. So as a group, we think about actually what's the best approach, why isn't it working, what does it look like? I mean, I think we're taking that learning into our approach with our community mental health teams as well. So I haven't got the fast and hard rule, but I think the difference is if you're going to ED or you're going elsewhere, you might see lots of different people. And I think the landscape with that transition from young to adult services, when you're, that 18-year-old point, and how your kind of support that you have. So we're doing a lot of work at the moment around transition services and specialist services for 18 to 25-year-olds, because we know there seems to be a big kind of point of, well, you're treated this way in before you're 18 and this way after 18, and actually we need that bridging bit for people. So if you're in the community mental health team, you wouldn't see lots of different psychiatrists. They'd have that conversation. You could phone in and have a chat with a duty worker or your care coordinator, and that would be called something different in other places in the country, and it is going to change in Dorset. But yes, you do have that line of communication. I think what does happen is they get really busy, and we need to be mindful of that, but also about actually, I'm all for psychoeducation as well. How do we empower individuals with the information at that point of prescribing? And it's not just about giving a leaflet, it's being really open about the potential side effects and impacts. I really advocate for talking about all of the side effects of your libido, your sexual relationship, your weight, especially when you're struggling to maintain your identity. These are really important factors to hold in mind. But also when we're looking at people kind of, coming off their meds, equally that can be a really challenging time. So we really need to think about that for, your Ukrainian kind of colleagues, and also people that are kind of connecting to our services, because we know that can be a really vulnerable time for people as well.
I think it's beautifully said again, Lisa. I think that this is a challenge, I think, for all medicine in the UK. I think, the whole concept of your ability to navigate the system is so dependent on you as a person at the moment, rather than the system making it easy for everybody or easier for everybody to access. And that the whole kind of concept they call health literacy, that the psychoeducation will support with. And I think that's really, really critical. I think that there is no short answer to there being a single point of contact at this point for low level mental health support. If it does come through your GP, if that's the kind of level that you're at, then there is a very high likelihood that you won't see the same GP, for the next appointment, unless you arrange that specifically. Where you're working with community team, as Lisa said, I think the likelihood is higher, and where you're working with acute services in the mental health system, then the likelihood is higher still that you will have the same points of contact and the same person looking after your care. But at the community level, it's much more variable. I like the idea of having people who are navigators, and I think that's a very clear part of the universal offer from Access Wellbeing in Dorset, where you can have an advocate or a buddy or a worker to go alongside with you to accompany you to those appointments, or to navigate your way to those appointments and look at then what happens next. And they're the kind of key point of continuity in your mental health support, rather than the individual providers, the GP or the other providers or other settings that you might go into and seek support from. And I think that's a really, your role, Alexander, with being able to provide the language or to rehearse the conversations with people is very much, I think, part of the ambition behind the universal offer with Access Wellbeing, is that we can empower people to be more confident about what they understand about their needs and what the services they're going to receive as well, so they can trigger those conversations when there's a concern that's arising, where things are changing and we're just feeling uncomfortable, or need another bit of reassurance about, is this the right thing? Should I be experiencing this? Is this expected? Is this part of normal, or is this something that needs further thought? So I think it's a really important question for us all, and clearly a very important question when there's another factor around the landscape of, you know, the languages that we use when we're talking to each other.
Yeah, true. Yeah, and I've got the question, Lisa. Do you have any special courses or something at NHS which helps, you know, probably psychologists to understand how the NHS works, how they can be, how they can, let's say, collaborate or refer or involve or yeah, in the process, or maybe there is something else. I know that there are several associations mentioned by John. They are accepted by the NHS. So if, for instance, I'm the member of association, that means that I can work with the NHS. Is it the way it works, or?
My colleague who was going to do this did talk to me briefly about this. He's going to have a conversation with our lead psychologist in Dorset, and to see what we could do to look at that. I mean, I can't make any promises, but he was like very kind of like, it'd be really interesting to think. I think, you know, it's interesting because we do have a lot of international nurses and students join us. And actually, what are those mechanisms, and what are those bridges? What are those courses that we do? So we do a lot of work about supporting our international students and nursing colleagues to feel part of the system, to have orientation, to feel connected as a community within our community. So and you know, what are the supervision structures, for example? And I think there I can't promise, but I know that it's essentially, I think it's about perhaps having a working group and thinking about working this through in terms of what it might look like and what we'd need.
I think there's an opportunity here in terms of looking at the models that are employed at those different levels, and what the impact would be, and what the requirements would be at each of those different levels. So I'm very conscious that within the work that Dorset Mental Health Forum does, there's a lot of peer-led work, which is supervised and managed and really you know, well worked through in terms of what's expected of each of the different participants and so on. There are opportunities, I think, in there which could lend themselves possibly to somebody coming from your group of experts, Alexander, that could work in that kind of space in a way, in that particular type of approach, where there may be slightly fewer barriers in terms of the qualifications and the kind of transfer of qualifications to a UK structure, as one potential offer. But I think it's worth, and I think that what Lisa said about having a little working group to follow on from this, it would be worth looking at each of those layers of the support, and to say, okay, what would it look like here? What would be needed there? What would you need in terms of equivalence from the Ukraine qualification and British qualifications to see people acting and taking on roles in those different levels of the system? So I would say that the action definitely off the back of this meeting is for us to get in a room together, virtually again or otherwise, to look through those particular offers and to see what you've achieved already, Alexander, with the counselling, transference and training, and whether there are other options that we could do which run in parallel or sort of, you know, alongside that.
And I'm just thinking as well, John, you know, the work that we've done in Recovery Education Centre around trainer model, about the approaches that we use in Dorset. And we've just got a training now about how do you create and hold safe and trauma-informed spaces, you know, and psychologists would be, you know, very adept at that, but actually what we call it here and why do we call it that? So I think there's some really interesting cross learning that, you know, it'd be really mutual in terms of, you know, that sharing. It would be really interesting experience, I think, and actually really worthwhile for the people that are here and need support. I have to say I've got a really soft spot for Ukraine, because my son used to be in the army, and he stayed for a long time in Ukraine before things happen. So, and he was always really welcome. So kind of it hits my heart, this work. So just wanted to declare my interest.
True, and thank you very much. And my question is, what are the further steps we may take? Without big promises, but let's see what we can do.
Yeah, I think getting us together in a room with Phil, who is due to come today, and potentially Morad is also involved in this conversation within NHS Dorset, to see if we can get together and analyse those points where we can start to put in opportunities or start to see the scale of the opportunity in there. The goodwill, I think, is huge at this point, and I think the variety of services that we've been through this afternoon shows the number of places we could be looking to collaborate together, and I think it's been incredibly helpful to kind of see the structure, because I think one of the things, Alexander, you challenged me with was not just looking at the trauma of the experiences of the war and the impact of that, but this is daily life. This is all of us just being human, and it's about accessing services because we're having difficulties in our relationships, or with ourselves, or with our children, or with our work, or whatever. And all these everyday things are also part of this potential need for mental health support, some of which will require much more significant work, and some will require the everyday mental health and well-being that all of us need. So I found this afternoon to be very what's the word, it's opened up a lot more possibility than I think we'd started to talk about already, and I really am very grateful for everyone who's participated, and look forward to the next part of the conversation.
Yeah, true. Thank you very much, John. Thank you, Lisa, and thank you for everyone. Do we have any questions?
I think from my perspective, if you had one wish, Alexander, what would you want in terms of, what would be the one thing that would help things move at the moment for you in terms of people's access and inclusion to services?
Give the clear, let's say, opportunity for Ukrainian specialists to be involved in the process, helping Ukrainians, living in UK, because on the one hand, that gives that returns a control. On the other, those who require help may address. On the third, they may become the huge asset for NHS, not just for helping Ukrainians, but that may create sort of a good practice for other nationalities, either other migrants coming to UK, and that may be sort of a best practice for other countries how to build up the system when the population of migrants start to help themselves being involved into the process and getting back the control over their life. That's my wish.
Thank you, everybody. Any other comments or feedback on what you've heard this afternoon before we finish? Okay, that's great. Well, final then thanks to everybody who's attended, and to everybody who's watching this after it's made public on our YouTube channel. We're very much interested in a dialogue around this and looking at opportunities. We have other colleagues that wish to attend this afternoon that it didn't quite fit with their diaries, who are also working in this space in other parts of the country, in Greater London and other places. We very much want to extend this as an offer to have that conversation with us. We will publish more stuff on our various websites, on Help and Kindness particularly, but I'm sure this will appear on NHS Dorset and Dorset Healthcare, and also on the Mental Health Forum website, as we get ourselves stuck into some of these practical things that we've discussed this afternoon. And thank you very much, everyone who participated. and shared in this discussion, and look forward to carrying on the conversation. And until then, thank you and goodbye.
Thank you. Thank you. Bye.
Thank you.